So now that you've seen your doctor and you've had the images performed and your diagnosis is lumbar spondylolisthesis. Yes, that's a mouthful. What is lumbar spondylolisthesis? Well, watch this video to learn more and what you can do about it. Can you do me a favor and subscribe to my channel and hit that bell so you're notified of all of our content when we put it out? We put out content on holistic health and wellness, physical therapy, Pilates, and we'd love to have you watching. So what are the signs and symptoms and what causes lumbar spondylolisthesis? Well, by the end of this video, you'll have a much better understanding of what it is and what you can do about it to help it. My name is Stephen Dunn. I'm a holistic physical therapist, and I've been treating patients and helping patients with this condition since 1998, and I look forward to helping you with your condition as well. So what are the symptoms of lumbar spondylolisthesis? The most commonly reported symptoms that I see are pain with walking, pain with standing still for extended periods of time, which is then relieved with sitting, pain after getting out of a car when driving for an extended period of time, reaching overhead, and those are just some of the many complaints that we hear about with lumbar spondylolisthesis. Now, how do you know if you have it? Well, most of you have already gone through this process and you've seen your doctor, you've had some imaging done, and maybe you've seen a specialist along the way. But an x-ray is the best way to determine if you have lumbar spondylolisthesis. And it's typically going to show up at lumbar 4-5, which we call L4-5, or L5-S1, lumbar 5, sacrum 1. So let me show you that here and what that means and what that is. So we have Fred here behind me, and L4 and L5, they're the lower two vertebrae sitting on top of the sacrum, okay? Now what lumbar spondylolisthesis means, and I'm gonna keep it in pretty simple terms, is it basically means where we have the sacrum here and the lumbar spine sitting here right on top of it, that the lumbar spine sitting on top of the sacrum, L5, or maybe it's L4 on L5, is slipping forward. So instead of being stacked up here where it should be, it actually slides forward. And as it slides forward, it creates pinching of the nerves, it creates all kind of havoc. So now I'm gonna show you what it would look like with some disc in there. Now this is showing a herniated or bulging disc. And then here would be where the lumbar 5 would be. And then there would be another disc on top of there. So just kind of showing you a representation of what it would be. The sacrum, boom, lumbar 5 with the disc on top and below. And so when that lumbar sacrum, or I'm sorry, when that L5 shifts forward on the sacrum, it's gonna shear on the disc and it's gonna lead to problems where these nerves are coming out of the spine at that area. So that is what lumbar spondylolisthesis is. It's a shearing of one of the vertebra forward. It's created typically by a fracture or an instability in the lumbar spine, in the back of the lumbar spine, and one of the little segments right back here. So that's what it is. Now, the treatment options, the main goal is to create stability, okay? Because we do lumbar and core strengthening to create that stability. But one of the main things you can do with it is learn to keep your pelvis and your spine in a better position. And that's where awareness exercises and the things that we teach in our Pilates programs and our physical therapy programs can make long-term effects on that. Now, many people, as soon as they see spondylolisthesis, they're told they need to go have surgery. I disagree with that, and I think it can be managed conservatively with awareness exercises, releasing what's tight and causing some of the imbalances, and strengthening what's weak and not allowing you to have the proper stability. Comment below and tell me what you learned from this video, and be on the lookout for the next in our series of lumbar spondylolisthesis videos. Now, if you can go to Amazon and download my book, Retrain the Brain to Solve Back Pain, it goes through a comprehensive program on how to work with repositioning the spine and awareness exercises to create the proper changes in your posture to improve your lumbar spondylolisthesis. And that can be downloaded again at Amazon. Look at the link below. Thanks for watching, guys. That's all for today. And if you're in Austin, Texas or Westlake Hills, then give us a call at 512-215-4227. We'd love to see you and help you with your lumbar spondylolisthesis. Thanks, guys, and have a great day.